live in Yateley and I run antenatal courses around Yateley and Sandhurst, both one-to-ones and group courses, predominantly hypnobirthing focused. I came to hypnobirthing when I was pregnant with my first daughter, Poppy. You can see Poppy being born there in 2019. I was terrified, quite frankly, of the idea of birth, and I thought it was going to be a very medicalised process. I thought I was going to want every bit of pain relief under the sun. I am a total wuss when it comes to pain and feeling poorly, so I fully thought I was going to be a very terrible pregnant person in labour. Luckily for me, I am also a control freak, and that part of me made me think I better actually do some research on this. And at the time, a book called Your Baby, Your Birth by Holly de Cruz, which is over there, was on the charts for Amazon books to do with birth. And luckily for me, that was about hypnobirthing. And it was one of those things where I was kind of reading it thinking, oh my God, like why has no one told me this? Why did no one teach me this in school? Why did no one tell me that this happens during birth? And it totally changed my mindset of why I sort of began to understand why it was that birth was feared and why it was that birth went wrong so often. But then on the flip side, I then thought, I actually feel pretty confident that I can do this and I can make sure that it all goes right for me. Which luckily it did, and I had a lovely first birth with Poppy in the Mulberry at Frimley. When I got pregnant again in 2021, I planned a home birth, and in 2022 I had Millie at home, which was even more amazing, under the Lavender team, which are our local home birth team. And it just, from when I had Poppy, it just ignited a spark in me. I just was obsessed with birth. I listened to every podcast, I read every book, I was obsessed with it. And I've seen firsthand what a difference it made to me going into my experience, and I feel like had I not have found that book, I know that my experience would have been very different, and I'm now seeing firsthand how much it can change people's experience for the better. And birth is not, you know, we look at birth and sort of pregnancy and birth and parenthood beyond as kind of separate events, but really they're all sort of intertwined, and your experience of pregnancy impacts your birth, and your experience of birth impacts how you go into parenthood after that. So I've become very, very passionate about helping people make sure they're going into birth feeling like they're empowered, they're in control, they're making good decisions that are right for them. Which is why when I was on maternity leave with Millie, I trained as a hypnobirthing instructor, and in 23 I set up Calmness Birthing, and this year I left my corporate job to do this full time. So I'm making a hell of a lot less money, but I'm getting to do something I really enjoy. So that's a sort of whistle-stop tour of what's led me here today. This is my first free event that I'm doing. I want to help get the message out to more people and give more opportunity to people to kind of find out about some of the things that I teach. So we know that for the most part, people go into birth wanting a physiological birth. So by this we mean a vaginal birth that has not had any assistance. So that doesn't mean no pain relief, that doesn't mean no induction, it just means that at the point of birth it is a vaginal birth with no assistance. So in a hospital environment, what percentage of women, bearing in mind that we know that most people go into birth wanting this, what percentage of women do we think end up having a physiological birth? We'll have a show of hands. Who thinks 40 to 50%? Who thinks 60 to 70%? And who thinks 80 to 90%? Okay, well, unfortunately, those that said 40 to 50%, 40 to 45% are correct. So here's some birth stats from some of our local hospitals. Sorry, Kate, am I in the way to do that? Can you still see this? So on the left-hand side, we've got Royal Berks, and on the right-hand side, we've got some from Frimley. So as you can see, the rates of unassisted vaginal birth in these places is, well, 38% at Royal Berks on that particular month, and 45.99 on that month at Frimley. Across the country, it is closer to 40%. Frimley, we are very lucky. I don't know if 45.99% is lucky, but we we are lucky that actually our stats at Frimley are better than in other areas of the country, other hospitals in the country. So we've got around 40 to 45% of people having an unassisted vaginal birth, around sort of 10 to 12% the assisted vaginal, so that's forceps and 1, 2, and anywhere between sort of 40 and 50% caesarean. Now, the World Health Organization says that only about 5% of people should require that sort of level of intervention during their birth. So, to have stats like this is a little bit of an anomaly, and it would be quite easy to look at stats like this and go, well, it's obvious, we're just shit at giving birth. We should all just accept all the intervention that we can get because, you know, we've got no hope. What chance have we got? We're rubbish at giving birth. But before we come to that conclusion, I'm going to take you to a home birth environment. So, of women that are looked after by a home birth team, what percentage of those women do we think have a physiological birth? Have a show of hands, 45 to 55. 65 to 75? 85 to 95. It is around 85 to 95% of people having a normal vaginal birth without assistance. Now, when you look at the home birth stats, you have to take them slightly differently. So, Royal Berks here have got an 85% have had their home birth. So, what that means is 85% of the people that the home birth team looked after in the lead up to their birth, because once you decide that you'd like to have a home birth, you go under the care of the home birth team. So they look after you during your pregnancy, they come and do a lot of your appointments at home. So of the people that the home birth team had booked in with them, 85% of those women had their home birth in the Royal Berks, 89% with the Surrey Hills home birth team, and 88% with the lovely Lavender team, who are our local team that delivered my little Millie. But what we know is that these figures are actually probably higher, because we don't know that 15% from Royal Berks, the 11% from Surrey Hills, we don't know what those women went on to do. They may have had a physiological birth in hospital. We don't know whether they chose in advance to have a normal birth in hospital, whether they chose an elective caesarean, whether they transferred during the course of their labour. But we know at a minimum, 85% of them, 89%, 88% of them must have had a normal, I say normal, obviously as we've seen on the previous stats, physiological birth isn't the norm anymore, but must have had that physiological birth. So, okay, maybe we're not so shit at giving birth, but where is this disparity coming from? And that's what we're going to take a bit of a look into today. Because I'm not saying everyone has to birth at home. I'm saying everyone should definitely consider it if they're having a healthy pregnancy, because actually, statistically, home is the place you are most likely to have a physiological birth. But I'm also very much a realist, and I know that for a lot of people, a home birth is not going to be something they feel comfortable with. But when we understand where the disparities come in, we can take steps to make sure that even if we're birthing in a hospital environment, we're making sure we put ourselves at the best possible chance of getting that physiological birth that many of you might be hoping for. So we're going to start with a bit of a biology lesson, and it was this first chapter for me in that book that was the kind of why don't they teach you this in school bit. So the hero hormones of birth. Without these hero hormones of birth, there is no natural labour, no natural start of labour. There is no progression during our labour, and when they are compromised, it can severely impact the progression and sensations of our birth, as well as potentially having repercussions for how we feel after and causing problems with things like feeding and bonding afterwards. So, oxytocin. Oxytocin is the absolute top dog when it comes to birth. The whole of birth lands on the shoulders of oxytocin. It is a build in oxytocin throughout the course of our pregnancy, which peaks just before we go into natural labour, that tells our body we're ready to start labour. And it's not just our hormones as well, it's the hormones that our baby is releasing as well. So at the time when our hormones peak and our baby's hormones peak, they send a message to each other to say, okay, let's get this show on the road. And it is oxytocin that is the main hormone that's doing that. It's the hormone of love. We produce oxytocin obviously when we feel happy, when we feel loved, when we're with people we care about, when we're doing nice things, we're going to be producing that fuzzy, warm, loving hormone oxytocin. So endorphins. Endorphins are our natural pain relieving It's thought that during the peak of labour, endorphins actually reach the level the same as getting a shot of morphine. So they are super powerful things that build with the oxytocin. They're like having a little communication between them as the oxytocin builds, and it's powering our contractions and making them stronger, making them closer together. The endorphins are also building as well to make sure that we can cope with those extra sensations, because our body's actually quite clever. It wants us to have more babies. It does not want us to go away saying, that was a horrible experience, I'm never going to do that again. It wants us to go away saying, let's have lots of babies, that was amazing. So if everything's working very well, oxytocins and endorphins work together beautifully to make sure that we're staying quite comfortable, even as the oxytocin is ramping things up. Relaxing. So relaxing is the thing that allows us to pass a baby through our body. Without relaxing, our pelvis obviously wouldn't be able to relax, as the name suggests, and allow the baby to pass through. So relaxing, again, builds through our pregnancy. It's why, unfortunately, towards the late stages of pregnancy, we feel a little bit uncomfortable, because your relaxing is causing your pelvis and all the other sort of muscles and ligaments around your pelvis to relax, and you've got the weight of a very large baby on it. So relaxing is making sure everything is able to move out of the way and allow your baby through. Prolactin is the one that we call sort of the mothering hormone. It is responsible for birth, but it's also the main one that's responsible for things like feeding and making sure that we're getting our sort of that instinct to nurture our baby and to want to feed our baby. And then melatonin. So obviously we produce melatonin all the time. But where melatonin comes into birth is that it acts as a sort of boost button for oxytocin. It's why a lot of people go into labour at night, because obviously we know our melatonin is going to peak sort of in the evening and through the night. So it's why, like I say, a lot of people go into labour at night, but also it's why those kind of niggles and Braxton Hicks contractions will quite often happen in the evening. It'll be kind of 9, 10 o'clock in the evening, you'll be settled down on the sofa going, oh my God, my stomach is going like a shelf, what are all these contractions that I'm having? Going to bed going, oh, I'm so uncomfortable, oh, maybe this could be it, maybe this could be it. And then in the morning, everything stopped. It's because that melatonin was acting as a boost button for your oxytocin, giving it that little practice warm-up contractions. So these are the hero hormones of birth. If all of these are flowing optimally, we are going to have a very productive birth. It's going to be nice and quick, but not too quick. The contractions are going to be just right. Our endorphins are going to work, and afterwards we're going to feel absolutely euphoric, and we're going to be able to feed our baby, and everything's going to be lovely, for the most part. But these hero hormones like us to feel safe, calm, unobserved, and undisturbed. Now, this safe, calm, unobserved, and undisturbed, I want you to remember this the whole way through, and think of these as like this oxytocin bubble, or this hormone bubble, of like, if in an ideal world, you would be in this absolutely like calm, comfortable, safe, everything's feeling very relaxed bubble, and all your hormones would be flowing with ease. So when we're making decisions about where we want to birth, how we want our birth to go, we always want to be thinking, is this going to make me feel safe, calm, unobserved, and undisturbed? We might not always be able to tick all of those things, but if we can't, then the next question is, how many of them can we tick? Or to what degree can we tick those? It might be, okay, I've decided for medical reasons, I do want to accept an induction. That makes me feel safe to know that I'm doing that, and I'm doing that in a hospital environment. Does that make me feel particularly calm? Not sure. Does that make me feel undisturbed and unobserved? I'm not sure. So what can I do about that? So safe, calm, unobserved, and undisturbed is the epitome of what we would ideally like to feel. And this goes for not just during birth either, because all of these hormones, like I was saying, they're not just for pregnancy and birth, they're for afterwards as well. So if you're struggling with breastfeeding, if you're struggling with bonding, these are the hormones that you're going to need as well. So it's often people who are very uncomfortable after their birth, or perhaps are very busy, very stressed, they're not giving themselves enough kind of downtime that that might struggle with those things as well. So it's not just during birth as well, this safe, calm, unobserved and undisturbed. If we're feeling like we're struggling afterwards, we need to think about whether we're ticking these boxes as well. So unfortunately, as with all good action films, the heroes have a threat. And the threat to the hero hormones are adrenaline and fear. So when we are producing adrenaline, this puts us into fight or flight mode. And fight or flight mode inhibits the production of our positive birthing hormones. Now, evolutionary, this was needed. Back in the days when we were birthing in a cave, if a saber-toothed tiger came to the door of our cave, we needed our birth to stop so that we could get away to a place of safety to find somewhere to birth our babies. You'll see it in animals even now, you know, cats. If anyone's ever had a cat that's had kittens or a dog that's had puppies, they just take themselves away, ideally, to somewhere undisturbed. And if somebody was to kind of threaten their peace and quiet, their labour would potentially stop. I don't know if anyone's watched Clarkson's Farm. I thought it was just birth programmes I could watch without getting enraged, like One Born Every Minute, but it's now extended to farming programmes. So every time Jeremy would go down to his animals with his bright torch and his camera crew, oh, what a shock, the labour would stop and they'd have to call the vets. And I'm going, leave them alone! That's why. So it's in evolutionary terms, there was a purpose for this. And when we're fearful, we can get into something that we call the fear, pain, tension cycle. So when we are scared, we are more tense, and when we are more tense, we're more susceptible to feel pain. And therefore, the cycle perpetuates. So, like I say, this served us well in evolutionary terms. We've only been birthing in hospitals for 70, 80 years, so we haven't quite caught up. So our brain still perceives things as threats. So that journey into hospital, arriving at the hospital, which is an unfamiliar environment with new people and new smells and new sounds and the sounds of other people birthing, your brain is going, what the hell, I'm not sure about this, this looks like a threat to me, I think I'm going to stop this labour because I need to get to a place of safety. So that is why we need to be finding our techniques to get back to those feelings of safe, calm, unobserved and undisturbed all the time, so that we can try and make sure we're keeping adrenaline and fear at bay as much as possible. Because we are, again, I'm a realist, it's impossible for us to say adrenaline and fear are not going to creep in at any point in our labour, because we are conscious, thinking humans. We have that fear around birth. Unfortunately, animals have an advantage over us there. They don't fear birth. They haven't watched One Born Every Minute. They haven't watched Friends. They haven't heard Sharon down the road's birth story. We have. So our brain is going to go, even if you're telling me I'm okay, still a little bit of fear creeping in. So what can we do about that? So let's just start with the hypnobirthing techniques. And actually, seeing as I'm hypnobirthing focused in a lot of my courses, we're only going to touch on hypnobirthing a little bit here. And the reason for that is that hypnobirthing is brilliant. And the hypnobirthing skills that you can learn are absolutely brilliant for helping you keep calm in stressful situations. But as we're going to learn, that's not enough anymore to make a positive birth. Somebody could go and do all the hypnobirthing techniques, but if they haven't done the birth prep, if they don't know their options and things like that, that's potentially going to hinder their birth as well. But a few hypnobirthing techniques, because we have the ability to change our mindset before birth and calm our nervous system at any time. And this isn't just for birth. Trust me, when my 2-year-old is having a tantrum about putting her shoes on, I go back to some of my calming techniques. I use them on a day-to-day basis. So these are calming techniques for life, not just for birth, but they also work very, very well during birth. So the first thing I'm going to teach you is a breathing technique. So we can tell our body that we are calm by the way that we're breathing. Obviously, when we're starting to get nervous, we tend to naturally breathe quicker. And by consciously slowing our breathing, we can tell our nervous system, no, we're okay, we're calm, we don't need to be breathing like this right now. So a relaxing breath is a breath that I teach. And to have a relaxing breath, you need to breathe in through your nose for 4 and breathe out through your mouth for 8. So feel free to have a little practice while I talk you through it. So we're breathing in through the nose for 4 and out through your mouth for the count of 8. Now this might not feel comfortable for everyone, especially if you've got baby pressing on your rib cage at this moment in time. But what you're aiming for is double the length of exhale to inhale. So if 4 and 8 feels too long for you, you might like to try 3 and 6, or even 2 and 4 if you're really, they're really up there. But we're aiming for double the length of exhale to inhale. And this is a really good calming breath, like I say, for any point in your life when you just need to tell your nervous system, it's okay, I'm calm. The other positive about optimal breathing is, of course, our uterus is a muscle. It needs oxygen-rich blood. Just like when you're exercising, if that uterus of yours is not getting enough oxygen-rich blood during the course of your labour, birth is going to feel more painful. So not only is this breathing technique going to help calm your nervous system, but it's also going to help make sure your uterus is getting that oxygen-rich blood as well. When you're breathing out through your mouth, really focus on kind of actively relaxing your jaw, relaxing your shoulders, almost letting any tension sort of flow down through your body. There is a direct link from your jaw to your pelvis. Floppy face, floppy fanny. It is a thing. If you are holding tension in your jaw, your pelvis is going to be tighter. It's why ideally you want to avoid sort of forced pushing and coach pushing, which back in the day would be called like purple pushing. Because if you're really, really tensing, your pelvis is actually tightening. So you're pushing down against a tight pelvis, which is potentially going to stress your baby out, it's definitely going to stress you out, and it's also going to put you at high risk of tearing as well. So ideally, what you want to be doing is waiting until your natural expulsive reflex, or waiting until you're feeling that natural urge to bear down, and breathe your baby down. So you want to be really using that out breath to flow down your body and release your pelvis rather than holding any tension. And it's something your birth partner can be really aware of as well. Like make sure you tell your birth partner this, and if they see you gripping with your hands, gripping with your jaw, any sort of tension, they can just consciously say, make sure you relax, and you might tell them to get off, but you know. But at least they try. So guided relaxations. Guided relaxations are really helpful. They help you in the lead up to your birth. It's all good and well me saying you have to be calm, you have to be relaxed, otherwise spontaneous labour isn't going to happen. But we have busy lives, we perhaps have other children, we have stressful jobs. To say you have to relax is quite hard. But what we can do is take time in our days, in our weeks, to actively make time to relax and do these guided relaxations. And a lot of them are really lovely visual relaxations that kind of help you with your mindset, help you with practicing your breathing, and you can then use them. The more you practice them in the lead up to birth, if you then do them when you're in labour, your brain's already going to be used to doing that guided relaxation. It's going to associate it with being relaxed. So doing guided relaxations and taking that time in your pregnancy to actively spend some time relaxing is a really positive thing to do. So anchors. Anchors are an association with a feeling. So they're not just related to relaxation. They can be about anything. You know, you hear a song and it just automatically takes you back to like a moment in time, like a song you loved at uni, or like a song you used to listen to when you were a kid or something. It's that association. And we can build these for during labour to help promote those positive hormones. So it could be that we're building in associations with things that make us feel happy. It could be that we're building in associations with things that make us feel relaxed. So think about what associations you already have, and think about what associations you can build. So that might be, so I had playlists to listen to during my birth, and one of them had all songs that make me feel kind of emotional, like songs from my wedding, songs from my sister's wedding, songs from my childhood, songs that just promoted feelings of happiness and relaxation in me. And in the lead up to birth, I would have a bath, and in the bath I would have candles burning, and I would have the guided relaxation on in the background, or perhaps my music. So I was building up an association with that smell, with that sound, with the water. And all of these are then things that I used in birth. So I'm a big fan, and I've got some of them out on display there, of the M&S ranges, like the Calm and the Meditate range, because they've got so many things with each of them. So you can have like the candle and the body lotion and the roller ball and the room spray. So it's easily things that you can build the associations with at home, and then you can pop a version of it in your hospital bag to take wherever you need to be to help you when you need to bring about that feeling of calm in an environment that might be unfamiliar for you. So think about things that you already have, build as many anchors as you can. And it can even be things like, I don't know, you've got a favourite blanket that you have on the sofa in the evenings, or your pillow. Like, I know that I'm pretty obsessed with my pillow from home. I always take it on holiday with me. So for me, if I was going to go into hospital, I would definitely have wanted my pillow from home with me. So those are anchors. Your positive affirmations. Our mindset, like I was saying about the animals, you know, we can't help as human beings that we hold certain fears around birth, and we hold certain assumptions around birth. So the more that we can expose ourselves to positive feelings about birth, in the form of positive affirmations cards, or listening to positive affirmations, or reading positive birth stories, listening to positive birth stories, the more that we can help build that positive association. And the visualization. So a lot of the guided relaxations will take you through kind of imagining that moment that your baby is born. And the more that you can spend time picturing your perfect birth and the exact way that you want it to go, it will build that sort of feeling in your mind that that is the way it's going to go. It's that kind of self-fulfilling prophecy. If you go into it thinking it's going to be awful, it's all going to go wrong, it's more likely to be awful and all go wrong. Whereas if you go in saying, this is going to be the most amazing thing, I'm so strong, I can do this, you're just reinforcing that idea to your brain. This is going to be okay, I can do this. So that's a whistle-stop tour of hypnobirthing. I would really recommend you learn a bit more about hypnobirthing. Obviously, I'd love all of you to come and do a course, but if that's not an option, there's loads of books, some of them that I've got on display here. I'm going to give you all, I'm going to send you all by follow-up email this recommended resources list. And it's got loads. It's got books, it's got podcasts, it's got websites. So if a hypnobirthing course is not an option for you, there's lots of things you can do to help you learn some of the hypnobirthing techniques that are going to be really helpful for you. And make sure your birth partners know them as well. Any prep you do, make sure your birth partners are doing as well, so that they can help you on the day. Birth environment. And I know Kate's already got this on point this week. I have seen on her Instagram she's bought a beautiful light that creates lots of ambient feelings around the room. So the hormones of birth like our environment to be low lighting, and it helps promote those feelings of unobserved and undisturbed. And also thinking about melatonin. Any environment that you would want to go to sleep in is the environment you should be birthing in. So whoever invented the lighting in hospitals on labour ward should be shot, because it could not be further from what oxytocin and the other positive hormones like than what is ideal. So low lighting. Now all of these pictures, this one was in the Mulberry, but all of the others are on labour ward. They have something called the positive birth box, and it's unfortunately, because on labour ward is probably the time that you really need to be maximising your hormones. But unfortunately, it's not always given a standard, but it's always an option available to you. Just ask, please can you dim the lights? Please could we have one of the positive birth boxes? But also, you can prepare this yourself. You know, you can take anything you want into hospital. The diffusers, lights, LED candles, all those kinds of things, you can take them wherever you want to be. But it's all possible, you just need to ask. So, the low lighting, eye mask and headphones. Eye mask and headphones are really good for when you can't control the environment around you. It's likely that if you're birthing in hospital, you will first go into triage before you're then taken to the Mulberry or the labour ward, wherever you're choosing to birth. And unfortunately, in triage, it's quite difficult. They don't have the option for these lighting. But what can you do? Well, you can put an eye mask on and you can put your headphones in so you can block out the sounds and you can block out the light. and you can help promote the feelings of safe, calm, unobserved and undisturbed, even if you can't physically do anything about them. Using water. Now, we know that using a pool or a bath or a shower, using water during birth is going to help with pain relief, it's going to help shorten the length of your labour, it's going to help reduce your chances of tearing, and also water helps with the environment. When we're underwater, we naturally just feel less on show, less observed. When private areas are under the water, we feel a lot less observed. So using water can really help with the environment and have many other benefits as well. Keeping people to a minimum. So that feeling of undisturbed. If we've got lots of different people coming in and out of our birthing environment, every single one is going to trigger that thought in our mind of, who is this? What is this person coming in to do? Are they somebody who's going to come and tell me that, you know, something's wrong? If every single person coming in and out is going to trigger a reaction in your brain. So the least amount of people that we can have in our birthing environment as possible. And knowing that it's your choice who you have there. You can ask people to leave the room at any time. You can ask for there not to be that student midwife there if you don't want them to be. It's your choice who you have in the room. And if you do start to feel like there's too many people in the room, but you don't want to ask them to leave, the other thing you can do is just make sure you turn your back to them. Just make sure you're kind of blocking out what's going on behind you. And the blanket and pillow from home, obviously I mentioned that in the anchors, but that can really help your birthing environment, just with that familiarity. And your birth partner, like I said, your birth partner knowing all these things so that they can be this kind of protector of this oxytocin bubble. And birth partners really like to have jobs. They like to feel useful. So they can be the ones that are responsible for maintaining, for asking for this environment, or putting on the level, you know, LED candles, putting on the light, making sure they're keeping that environment optimal for you at all times. So optimal birth positions. So we're moving slightly away from the hormones here, but another reason, going back to that kind of how can we make physiological birth work. So starting with the hormones, when our baby's head is putting pressure on our cervix, it tells our brain to produce oxytocin and endorphins. It's why doing lovely swaying motions, like we're having here, is so good, and keeping active during pregnancy is so good. Because in the late stages of pregnancy, actually the worst thing we can be doing, well, not the worst thing, because you do need to make sure you're resting, but the positions that a lot of us spend a lot of time sitting in, sat in a chair, sat in the office, sat on the sofa, is actually really not the best position for getting your baby in the right head down position and getting your baby applying pressure to your cervix. So, making sure we're really active in the lead up to birth is really, really important, and being conscious, if we have been spending a lot of time sitting down, can we then spend some time going for a walk, spend some time on our birthing pool, spend some time sort of forward leaning, rocking, giving baby kind of like a bit of a hammock almost to allow space for them to move down into the pelvis. So for the lead up to birth and then during birth, optimum positions are going to be upright and forward leaning so that your baby's head is really applying pressure on your cervix, like I say, to get those hormones flowing. Is gravity on your side? It sounds obvious, but if gravity is not on your side, then your baby's going to be working harder to move down. It's why upright positions can be really useful during birth. And upright doesn't have to mean exhausting, because I remember when I was sort of looking into this and I first thought upright positions, I kind of imagined people like holding a squat or like leaning against a wall, and it all sounded a little bit sort of tiring. But it doesn't have to mean that. It can literally be, you know, raising the head of the bed and leaning on the back of the bed, leaning on a birth ball, leaning on your partner. And if you really, really don't want to be upright, then you can do left side lying, is the sort of the optimal lying position. Now, the reason we don't want to be on our back is for two reasons. Firstly, the exact same reasons that they recommend you don't lie on your back during pregnancy. Obviously, you've got the weight of the baby. So if you're lying on your back, it can potentially restrict blood flow through the placenta. And you've got more chance of complications like babies having heartbeat abnormalities. The other thing is, when you are in labour, when your baby is making its final descent, it has to navigate past your pelvis and your coccyx. Now, if you are, this is the pelvis, this is your coccyx. If you are in an upright and forward leaning position, Your baby will first navigate your pelvis before it then has to navigate your coccyx. If you are on your back, it has to navigate them both at the same time. The other thing is your coccyx will actually move up to 30% during that final descent of the baby's head to allow the baby's head to move through. So again, if you're lying on your coccyx or sitting on your coccyx, your baby has literally got 30% less room. Now, your pelvis is meant to birth the baby, but that's not saying it's not a tight squeeze. So that extra 30% can make a really big difference. So that's why always thinking, have I got gravity on my side? Am I off my back? And is my coccyx free to move? So if you are in a laying position, left side lying is optimal because that's going to make sure the blood flow is still going through the placenta and you're off your coccyx so that it can move and give your baby that much needed extra little bit of space. And also thinking about going back to promoting those feelings of calm and of feeling undisturbed. If we are on our back with our legs, with everything open to the room, that's not really going to be promoting a feeling for most people, I don't think, of privacy. So it's positions that are going to promote the feelings of strength and privacy rather than making you feel vulnerable and exposed. And the final point on birth positions is follow your instinct. I hear so many birth stories, unfortunately usually people that are coming to me second time round after having a difficult first birth, and they're saying, I was saying I needed to get off the bed, I was saying I needed to do this, and I was being told, no, you need to stay on the bed, you need to stay in this position, we need to have the baby's heart rate, on this, you can't move. And that's not allowing you to follow your instinct. And your instinct might tell you to get in a position that doesn't fit the bill of any of those things. But if that's what your instinct is telling you, there will be a reason. There's a popular other birth educator who said she got the urge with her second child to go upside down. And she said, I don't know why, I just had this urge to go upside down. And actually, it turned out her baby was like back to back and in a funny position. And actually, the position she got herself in just allowed her baby to turn. Now, no one's going to tell you, oh yeah, standing on your head is a really good idea during birth, but if that's what your instinct is telling you, follow your instinct, because there will be a reason. It might be that baby's in a funny position, it might be that they just need help around a corner, but whatever your instinct is telling you, follow it. And that's not just for birth positions either. So, again, going back to what can we do to help promote physiological birth? Waiting for labour to start on its own, wherever possible, is a really good option. So, we have a very varied gestation as humans. Some animals, I think rats, it's like they all birth on like day 32 of being pregnant or something like that. As humans, we have a very varied gestation. 37 weeks is perfectly normal to go into labour. 42 weeks plus is perfectly normal to go into labour. But as we were learning when we were talking about hormones, our hormones peak just as we go into labour. The peaking hormones is what tells our body to go into labour. So if we're inducing labour before we would naturally have gone into labour, we've got this gap in readiness in our hormones. We also know that the methods used in inductions and the process induction can lead to other interventions and other drugs which can potentially have downsides for our birth and have associations with less likelihood of having a physiological birth. So we know that people want a physiological birth. We know that inductions has these drawbacks, and yet for the first time last year, more people were induced with labour than not. So over half of people last year birthing either had an induction or a planned caesarean. So less than 40% of people actually went into labour naturally. So when we go back to think, why are these physiological births not happening? That's a very good starting point, because obviously we can't be induced at home. When we start looking at things like that, this is where this disparity is starting to happen. We've got the environment and we've got things like that, but induction is something that is associated with less likelihood of physiological birth. But when we understand why, we can make choices to make sure that even if we are accepting an induction, it's all on our terms, and we're getting our environment on point, and we're going back to what I said about that safe, calm, unobserved and undisturbed. How much of it can we tick? What other things can we do to make sure, okay, I understand that these are the potential implications for an induction, and I'm going to do my utmost to make sure that I'm ticking all the other positive boxes to make it a positive induction. And the final point, because we are approaching the festive season, which also means higher induction rates. Less babies are born on Christmas Day than any other day of the year. That is not because less women go into labour on Christmas Day, it's because they don't do routine inductions and they don't do planned cesareans on Christmas Day. So if you are considering an induction around that time of year, you may well be encouraged to do it a little bit earlier than you otherwise would have, so that they can manage their Christmas staffing. As much as I love midwives, their Christmas staffing is not your problem, and you should not be accepting any intervention earlier because of that. I had it with some clients over Easter. They were adamant that they didn't want to consider talking about a certain thing until they were 41 weeks, and they got a text message at 39 weeks saying, "We've booked you in for this appointment." And she sent a screenshot to me, and she said, "Why are they booking me in? I said I didn't want to talk about it till 41 weeks. I said, "I don't know, ask them." So she asked them, and she said, "Oh, they said it's because it's the Easter holidays, and they've got less staff." I said, "Go back to them and say no." Their staffing levels are not your problem. So continuing that theme, avoiding unnecessary interventions. So knowing that every check, every bit of monitoring, every intervention is all your choice. Every single one of them, and some of them may be harmless, some of them may seem harmless, but all of them will potentially have implications for your labour, whether that's because it's compromising that safe, calm, unobserved and undisturbed, or whether it's because it's involving drugs that will actually potentially sort of disturb your hormones. So let's take vaginal examinations, for example. I don't think there's many people that feel very, very comfortable with having a stranger put their fingers inside the vagina. It's just not really something that we're particularly comfortable with, is it? So every vaginal examination that you accept, you have to be aware that that might potentially disturb the hormones and how you're feeling. So thinking, is this something that I definitely want? How do I feel about this? Augmentation of labour. So augmentations of labour is anything that speeds labour up. So you may well have heard the term failure to progress, and especially in a hospital environment, there are very sort of definite timescales for when they want to be seeing things to be happening and how quickly they want you to be dilating. And that kind of going back to the vaginal examinations, that is why you will be routinely offered them on arrival at hospital and throughout the course of your labour. There are lots of other ways that they can determine how advanced you are in your labour. But it means somebody taking some time to sit with you, to spend time observing you, listening to the sounds you're making, observing your body language, observing your noises. And obviously, unfortunately, in a hospital environment, they don't have the staff to do that. They want to make a quick decision as to whether you need to be going onto the labour ward or whether they want to be sending you home. But that doesn't mean that you have to accept it. There's no entry requirements to the hospital of having a vaginal examination. So going back to the augmentation of labour, it's that there's very definite timescales that they want you to be meeting at certain sort of points. So they may well suggest things like artificial rupture of your membranes or popping you on an oxytocin drip, but those sorts of things are going to potentially, your environment is potentially going to be impacted, your natural production of your hormones is potentially going to be impacted, and we know that there's associations with those things and increased levels of intervention further down the line. So it's making that decision, are these things that I want to say yes to? Because natural pauses can be just that, natural pauses in labour, and often there's a really good reason for them. It could be that baby just needs a little bit more time to get round a corner. It could be that baby's actually struggling a little bit with the process of labour, because it's quite a stressful process for babies, especially if their hormones haven't peaked or they haven't reached full maturity. So sometimes these clever little babies actually just have a little pause because they just need a little break. And then after they've had that little break, things will ramp up again. But if we try and speed them along, that's when we can potentially have, oh, actually, baby's seeming a little bit distressed. We might need to think about helping baby out. So it's thinking, okay, am I being offered this because of the sort of the timescales that everyone gets offered it, or am I being offered this because there's an actual medical reason that it's important for me to have this? And that's a theme that we're going to kind of learn about a bit more in relation to other things as well, but always thinking, is this standard process, or is this because it's beneficial for me at this time? And being aware of that cascade of interventions. So it's quite common for one intervention to almost kind of lead to a bit of a cycle. So, I'm a bit overdue, so I said yes to a membrane sweep, and it made me really uncomfortable for a few days, but nothing happened. So then I went into being induced. I started with the hormone pessary. Another day went past. It helped things a little bit, but I was still only 1 centimetre dilated. So then I went on to the oxytocin drip. That ramped things up really quickly. The contractions were really strong. The contractions were really close together. So then I really wanted an epidural. So I had the epidural, but then everything slowed down. So then I needed more oxytocin. So then I needed more epidural. By this point, I didn't really have much movement. I was on the bed, and then they said baby got a bit stressed. And before you know it, we've got this emergency situation, or we need to do an emergency stare. We need to help baby out quicker. And then the doctors go, oh, thank God you're in hospital. Thank God you're in hospital so we can save the baby from that stressful situation. And it's like, well, actually, look at everything before that. It was that cascade of interventions. Now, that's not saying that you're always going to want to say no to induction, and you're always going to want to say no to every intervention, but it's about knowing the pros and cons of every single thing so that you can have the opportunity to break that cycle and say, okay, I'm happy with this, but I'm not happy with that. And if this doesn't work, I don't then want to go on to that. I want to go to my plan B. It's about knowing how to break that cascade of intervention, and that's where your hypnobirthing techniques and thinking safe, calm, unobserved, undisturbed. What other things can I be doing to make sure that I'm keeping my environment optimal, to keep my hormones optimal, so that I can try and avoid this cascade of interventions? And hugs before drugs. So hugs before drugs means just what I just said. Are we making sure everything else is on point? Are you feeling safe? Are you feeling looked after? Are you feeling calm? Are you feeling loved? Before you reach for the drugs, do you feel that everything else around you is as on point as it can be? I know there's not always going to be situations where you control everything, but there should always be some things that you can control and to help you with those feelings of safe, calm, unobserved, and undisturbed. Your baby, your body, your birth. So knowing that everything is your choice is probably one of the single biggest things you can go into birth knowing. Because we know that birth trauma is most highly associated with when people haven't felt in control. Like I said, I'm not saying you're always going to want to say no to induction. You're not always going to want to say no to an intervention or a check. But when it has been your choice to accept that, and it is very much on your terms, you are going to feel much, much better about that decision than somebody who has felt like that decision has been put on them, sort of against their will, or without giving them the options to decide whether that's what they want or not. We get told a lot of you have to's and you can't in birth, especially if for any reason you've been put in a more high-risk category. If you have been told that you need to be console-led, or you have fallen into any particular risk categories, which a lot of people now do, you will be told a lot of you have to, you can't, you're not allowed to birth on mulberry, you have to have an induction at 38 weeks, you're not allowed to have a water birth, lots of you have to, lots of you can't. But what does that actually mean? Well, if you're being told that you have to and you can't, or you're fitting within a certain risk category, it means it's in the guidelines. Guidelines were never meant to be for us. Guidelines were exactly that, a guideline of care for the medical professionals to follow. And what they were originally intended for was that is what every person that fit into that category, a certain guideline of care that they should be offered as a choice. And unfortunately, it's become that the guidelines are now, you have to do that, and sort of given to people less of an option now. But the problem with guidelines is Often, they are not actually backed by good evidence. So only about 30% of the guidelines that are currently in place actually have good quality data behind them to support the journey of care that they are recommending for people. You only have to look at the fact that within certain areas, the guidelines are totally different. So, for example, somebody that's had an IVF pregnancy, you can have two women that have had near identical journeys to conception and are having near identical pregnancies. But if they are a town apart or a hospital apart that have different guidelines, one can be told you have to be induced at 38 weeks. You can't birth on a birthing centre, it would be far too risky. You have to have managed delivery at the centre. The other one won't be consultant-led, won't be told any of that, and will be told, yeah, of course, you can birth in the birth centre, you can have a home birth. Is there any difference in those two women and their bodies? Well, of course there's differences in their bodies, but in terms of their journey to get there and their health at that time, they are both exactly the same, but one happens to be in a different area to the other, and therefore their guidelines are different. And I think that really highlights the fact they are probably not backed by good evidence, because if something had very, very, very strong evidence behind it, we would all be doing the same. There are many guidelines where they are the same across all hospitals. For example, the offer of a 12-week scan. It's something that's done in every hospital across the country because there's quite good evidence that viewing a baby at that stage can help pick up any early problems. It gives mums peace of mind. There's a lot of evidence that that is a good thing to do, so it's done across the board. There's lots of other things to do with things like IVF, having a high BMI, the age you are, how you've conceived, whether you've got gestational diabetes. That will vary wildly from hospital to hospital and area to area. So that is why guidelines are what lead to the you have to's and you can'ts. What you need to know is that being told those things does not mean you have to or you can't. Every single thing is your choice. And I would encourage you, if you are being told any you have to's and you can'ts, to ask why. Don't just accept it. Ask lots and lots of questions about why. I was speaking to a lady the other day and she said, oh yeah, well they told me I have to, I can't have a delayed cord clamp and I've got to have my cord cut immediately. And I said, oh okay, why is that? She said, I don't know, they just said that's what I've got to do. And I said, well you need to ask why, you need to ask more questions, you've got to know why. Because unless you know why, you don't know whether that's something that you actually identify with or not. Going back to that kind of broader, am I being told this because I just happen to fit into a broad category? Or am I being told this because it actually relates directly to me? So, like I say, I encourage you, if you are being told anything like that, really go away and ask for a bit more information, because you might find you don't really sort of relate to that category you've been put into. I had a client recently who had just, she was planning a water birth on Mulberry. We were midway through our course, and she got diagnosed with gestational diabetes, and she was very upset by it because she got told that you're going to have to be induced at 38 weeks, you're going to have to be on the labour ward, and she thought her birth was going out the window. But after our session, I gave her some books to read, I told her some podcasts to listen to, and she then came back to me and said, well, from listening to those, it seems like the risk factors associated with gestational diabetes are that baby can grow too large, or that if the diabetes is unmanaged, it can cause problems with the baby's blood sugar level. But my diabetes is managed, and my baby's sitting in the 50th percentile, so why would it make sense for me to be induced? And I said, that's a very good question. Go and speak to your consultant about that. And she did, and the response from the consultant was, yeah, you're right. There's actually no good reason why you should be induced. It's just that our guidelines are that we induce everyone that has gestational diabetes at 38 weeks. But you are absolutely right that you don't fit the criteria for the risk factors associated with it. So she didn't have her induction, and she had a lovely water birth on Mulberry, and everything was well in the world. So asking questions, because you might be surprised that actually you may not then end up feeling like you fit in that kind of risk factor that you've been given. So that's putting a lot of onus on you. I'm telling you to ask a lot of questions. I'm telling you to take control for your decisions. And it's a lot. So here we have a tool that can help you when you are trying to make these decisions about things. We call it using your brains. So the acronym BRAINS stands for B. What are the benefits of this? What are the benefits of this intervention or thing that you are offering? This test you're offering, this intervention you're offering, or it could be something like we're saying you should birth on labour ward. Okay, well, what are the benefits of that for me? What are the risks associated with this? Self-explanatory. What are the risks associated with this intervention or place of birth that you're telling me? And it has to be balanced. So if, for example, someone was saying to you, okay, we're recommending that you're induced because you're over 41 weeks, you would need to say, okay, so what are the risks associated with staying pregnant? What are the benefits associated with having this induction? What are the risks associated with staying pregnant? But then on the flip side, to balance that, we would need to know what are the risks associated with the induction and what are the benefits of staying pregnant. So we need to know the benefits and the risks, and we need to know the benefits of the risks on both flip sides of what's being offered to us. We also need to know what are all the alternatives and what are the benefits and risks to those. And we've usually got a lot more alternatives than we think. So, for example, if your waters break and you don't immediately show other signs of labour, you will be told quite commonly, well, you've got two options. You can be induced now, or you can wait 24 hours and then be induced. Of course, those are not your only two options. You can wait as long as you want to. You could say, okay, can we wait 48 hours? Can we wait 72 hours? Or can we do absolutely nothing at all? You've always got a lot of alternatives, and you always need to know what are the benefits and what are the risks of all of the options available to you. And knowing that no door should ever be closed to you. Something that I talk quite a lot about kind of natural birth and physiological birth, but actually something that's also really important for everyone to know is an elective caesarean is always an option to you as well. And that's another thing people will often be told, no, you can't, you don't fit the criteria for that. The only criteria for anything you want in birth, whether that's a home birth or an elective caesarean, is that it's what you want, and that's it. If that is what you want and that is what you feel is the best decision, that's all the evidence that needs to be given for that decision. So what are the benefits, what are the risks, what are the alternatives? And when you're looking at the risks, it's important to know the actual numerical figures. So not just, okay, your risk of this doubles, so the one that's very common, I'm sorry to keep coming back to induction, but obviously, statistically, at least half of you in this room will have to make a decision on induction, so it's quite a good one, and we get told we need to be induced for lots of different reasons, so it's quite a good one to use. But so after 41 weeks, your risk of stillbirth doubles, so you need to be induced. Well, okay, that sounds pretty scary. Yeah, okay, I'll do it. But if we say, okay, your chance, because risk, let's change the word risk to chance, because we've always got a chance of everything. Every time we get in the car, we have a chance that we might have a car crash, but that doesn't stop us getting into the car. We've always got a base level of chance of something happening, and no one can go into birth totally risk-free. We've always got a base level of risk or chance, as we'll call it. Your chance of stillbirth increases from 0.02% to 0.04% after 41 weeks. Altogether sounds a lot less scary. And when you weigh up the fact that actually what you're avoiding is the increased risk, because like I say, everyone's always going to have a certain level of risk. So what you need to be looking at is the difference. And this is a question for when you're talking about your circumstances as well. So, okay, I understand you're saying people with gestational diabetes are at an increased risk, but looking at my pregnancy, looking at my circumstances, what are you saying my increased risk is? And you want that in an actual numerical form, because saying you're double or 3 times as likely doesn't mean anything. You want to know double what, 3 times what. Actually knowing the associated figures. And then you can then properly balance that with the alternatives as well. You've got all the information that you then need to make a good informed decision. Intuition. The I in brains is intuition. What is your gut feeling telling you? You've lived in your bodies your whole life. You've lived in this pregnancy for 9 months. Your gut feeling counts for a lot. And it might be, it can, like I say, it can go one way or the other. Your gut feeling might be telling you, I know they're suggesting this intervention, but I really don't think this is the right course of action for me. I really think actually doing absolutely nothing and sticking with my home birth plan is the right thing for me. Or it might be, I just have a gut feeling something's not right here, and I want to have a cesarean, or I want to have the induction, even though they're telling me I might not necessarily need to. My gut feeling is telling me that's what the right thing to do is. And you should never ignore your intuition, because it serves you very well. We as women have very good intuition. We as pregnant women have even better intuition. We as mothers have very good intuition. You have to follow it. It is going to serve you well. So what is your gut feeling telling you about that decision? And nothing. What if we did nothing in this situation? What if we did nothing for an hour? What if we did nothing for a week? What if we did nothing for 10 minutes while we have a little bit more time to make a decision? Or what if we just did nothing at all? What if we did nothing? It's always an option. And the S in Brains is second opinion. Do you feel you need a second opinion on this? Whether that's you're consultant-led and you feel like they're pushing you down sort of one path, there's an amazing person called a consultant midwife. And that person is somebody who, obstetricians are experts in medical birth. Midwives are experts in physiological birth. The consultant midwife is the kind of the middle person. They are the ones that can be a really good, impartial person to speak to if for one reason or another the birth plan or the route that you are kind of being led down is not the one that feels right for you, and they can really help you put in place a care plan that you are happy with. So do you feel you need a second opinion on that? Or do you feel like you just need a bit more time with that person? Because I get it, I'm telling you to ask all these questions, I'm telling you to use your brains, but I understand that the appointments are short and it can feel like you're being rushed out of them. But if you still feel like you're about to leave that appointment and you've got questions unanswered, you have always got the right to ask for more time with your care provider, whether that's later that day or another day. You've always got the right to have more time or a second opinion. So, the benefits of making a plan, the benefits of making a birth plan. So, I've already said about how going back to the hormones, going back to those feelings of control, going back to feeling like if something is our decision, we are going to feel better about it. It's less likely to put us into that fight or flight mode. When we go about making a birth plan, and I'm going to send you all on Monday this. So, this is a birth plan template that I give to people that are doing my courses. I know it looks a lot, but this is just the template, and what this template will do is force you to go away and do some research on things. So, pain relief and interventions, environment, monitoring and examinations, before labour begins, birth phase, the third stage, do you want to birth your placenta naturally? Do you want a managed third stage? Do you want optimal cord clamping? The newborn procedures, do you want the vitamin K injection? It is going to force you to go away in the event of a cesarean, looking into a family centre cesarean. Every single part of your birth gives you options. And when you've gone away and done all your research on the pros and cons of every option available to you, you are going to feel much happier about your birth plan. And there's no harm. I think some people worry about making a birth plan because they feel like, well, if it all goes to pot, I'm going to look silly. If I've said, that I want an all-natural birth with no pain relief in water, and then I end up having an epidural on the labour ward and everything, then people are just going to think I'm silly. No. Think a bit like if you were planning a car journey. If you were going to drive to Manchester right now, you would put a route planner on your Google Maps, and it would tell you the best route to go. But if on the course of that journey, an accident happened, or they shut a road, you would divert, you would change your plan. And that's fine. And having a birth plan and going through the process of looking at all the pros and cons of everything and making a plan A and making a plan B means you're not having to make decisions on the day. Now, when we're in labour, that is not the time that we want to be making decisions. We don't want to come into that conscious thinking part of our brain. We want to be in that, a little bit out of it, very, very relaxed, subconscious part of our brain, because that's where our hormones are going to flow. When we have to come into the conscious thinking part of our brain and make decisions, that's when we're potentially going to be brought back into the chance of that fight or flight fear mode being sort of coming back in. So when we do all of our research beforehand, we can feel pretty safe in the knowledge that as our birth journey progresses, we can make good, informed decisions that we're happy with along the way. And when we do that with our birth partner as well, that means that our birth partner can help advocate for us. They can know our wishes and they can make sure that on the day our wishes are being heard when we want to stay in that place where we're not being spoken to. So sitting and working through your birth plan is a really, really good thing to do with your birth partner. Like I say, pain relief and interventions, make sure you know all the pros and cons to them. Make sure you know what you want to do about optimal cord clamping, and make sure you know your options for every eventuality, because then whatever happens, you will hopefully feel a lot more in control and a lot more that that situation is what you want rather than it being dictated to you. And really spend some time as well thinking about what you really want. Like, if someone was going to say to you now, right, just spend 5 minutes, close your eyes and think, what would my perfect birth look like? Like, if I didn't think anyone was going to judge me, if I didn't think anyone was going to say, no, you can't have that, what would my perfect birth look like? And that should then be your plan A. And it's not a case of like, can I have it? It's how do I have that? And if I can't have exactly that, how much of that can I have? And trust. The final thing that you can do to really put yourself at the best possible chance of having a good, normal physiological birth is to trust yourself. Trust the process, trust your body, trust that it is going to be positive and you are going to be able to have a really positive and enjoyable birth. So, that brings us to the end. I'm so sorry, I've run massively over, haven't I? It was always going to happen. My full courses are about 12 hours, so for me to try and decide what to put in an hour, it's just too much. It's too much for my little brain, I can't do it. So thank you very much. I understand that the information that I've given you tonight may well have given you more questions than it has answers. And I'm sorry if you hope to come and have all your birth prep done in an hour. But what I hope that I have given you is enough information and tools to now go away and build on it. Like I say, I'm going to send you all this recommended resources section. If doing a hypnobirthing course with me or another instructor is not an option, then there are lots of books that you can read that are really good. There are some amazing podcasts, and the podcast shows that I've put on there, you'll never be able to watch, listen to all the episodes, but you can find the ones that relate to you. They're all kind of specialist subjects, so if you were considering an induction, you can go and read the ones that are, listen to the ones about induction. If you did have gestational diabetes, seek out the ones about gestational diabetes, find the things that are relevant for you. And there's a couple of websites as well. So the AIMS website, the Association for Improvement in the Maternity Services, and a lady called Sarah Wickham are really good sources of information for evidence-based, very non-biased, evidence-based research to help you with things like your birth plan and making decisions. So thank you very much for joining me. Sorry that I have made you sit for more than an hour. Like I said, I am a small business. This is very, very important to me. I'm very, very passionate about helping people. So, if you have got any questions at all, or there is any more information that you want, please do come and see me. I'm very happy to help. If you'd enjoyed this evening, then please do give me a positive review on Google or Facebook. It means a lot because I do everything myself. My website is me, my marketing is me, it's all me. So any little bit of positive encouragement that I can get is really, really important to me. I have put in your bags, I have given you all a feedback form and a pen. If you can take another couple of minutes just to quickly fill that in, I would really, really appreciate it. I've put a little bag there for you to just put them in. I hope to be able to offer these free events kind of at least once a quarter. So it would be really good to know what information you found useful, what information you would prefer me to talk about, and if there's anything that I can bear in mind next time. I won't put questions to the room because I am so over. But what I've done is I've put a leaflet in all of your leaf bags, and on the back I have put my mobile number. So feel free to reach out by any of the means of contact. But also, if you've got a burning question right now, just drop me a voice note or send me a message on your way home, and I will get back to you either over the weekend or on Monday. And yes, I wish you all the very, very best of luck as you continue your pregnancy journeys.
Thank you.
You're welcome.